A life in which you don't have time for yourself, time for your family, or those who matter for you. Long commute, even longer work hours. A lot of people choose fast food versus a healthy diet so they can gain a few precious minutes or hours. This kind of high-stress lifestyle can lead to the development of GERD and peptic ulcer disease.
So I'm so glad we were able to meet.
I know, it's been a while actually. How you been?
I've been all right. Actually I almost didn't come because I'm okay when I eat, but like as soon as I start eating, I feel like I'm gonna throw up and I have chest pain, almost like I'm wondering if I'm having a heart attack. And then I laid down for a little bit and didn't make it better. So I'm just drinking some caffeine and I had a little bit of bacon in the car.
Has that been happening for a while? That doesn't sound normal.
A couple months.
Okay, maybe you should get that checked out. I don't know.
No, I just don't have time, and I eat a lot of fried foods because I'm always on the go, so I feel like I'm always eating fried foods.
Okay, so I saw this special on Dr. Oz that you probably shouldn't be eating that much fried food, so maybe we should cut it down.
TV, but you watch a lot of TV.
You're right.
But it's so fun to watch.
Can't stop.
Oh my god, guys, sorry,
girl.
I coming late. I thought I couldn't make it. I got a bad headache. I took tons of ibuprofen with this, and it didn't help with my headache. And I feel so nauseous between meals, and I haven't had anything on my stomach completely empty right now. I haven't had any food since early this morning.
Why are you drinking this? Didn't we say you were gonna try and cut back?
I drink that in between coffee. What's wrong with that?
What's wrong with you?
I thought it would help me with my pain, and I this morning when I woke up, I felt nauseous and I vomited like a brownish color. I think it would be a concern.
Yes.
But you need that to keep going. I mean, you've got a lot going on.
Yeah, I got so much stress, and I got so many things going on right now. My finals and work didn't give me a time off. I don't know what to do.
As Dr. Oz's #1 fan, I would definitely say you need to go get checked out. That does not sound healthy.
Go on Dr. Oz. I'll watch the show. We'll TiVo it.
We'll get tickets to the live thing.
I thought we'd do together.
Maybe Dr. Oz can cure.
Maybe he can
fix
diagnose
my
you.
problem.
That'd be so fun. I'll get popcorn.
Let's do it.
All right.
Hi there. Do you think you're one of the millions of Americans that are plagued with gastrointestinal diseases? You are not alone. Did you know that 60% of the U.S. adult population is plagued with GERD? Here are some symptoms you may be experiencing.
GERD is a common condition characterized by excessive gastric contents and enzymes backflowing into the esophagus, caused by incomplete lower esophageal sphincter closing, pyloric stenosis, hiatal hernia, excessive abdominal pressure, and motility problems.
Signs and symptoms of GERD include heartburn after eating, may worsen at night, chest pain, difficulty swallowing, regurgitation of food or sour liquid, sensation of a lump in your throat, chronic cough, laryngitis, new or worsening asthma, disrupted sleep.
Risk factors include obesity, older age, sleep apnea, nasogastric tube, and pregnancy.
Diagnostic studies include X-ray studies, upper GI endoscopy, fluoroscopy, barium swallow, esophagoscopy, pH monitoring of the normally alkaline esophagus, and radionuclide studies. But what can you do?
Treatments for GERD include lifestyle modifications, smoking cessation, reduced alcohol intake, weight reduction, and managing stress. Nutritional therapy. Avoid reflux-inducing foods such as fatty foods, chocolates, coffee, and tea. Eat small, frequent meals, and avoid late-night eating. Drug therapy. Antacids for heartburn relief. Proton pump inhibitors and histamine receptor blockers to lower hydrochloric acid secretions and reduce irritation of esophageal and gastric mucosa. Surgical therapy to enhance the integrity of the lower esophageal sphincter.
Oh my gosh, hi, how are you? What are you doing here?
Okay, I didn't see the nurse to go over my test result. How about you?
Same.
Oh,
Well, good luck in there.
all right, same to you.
All right, bye.
Bye.
Oh, he's cute. No. Yeah, cute. Come in. No.
Good morning, Miss Christie. My name's Alvin. I'll be your nurse today.
Hi.
The doctor already told me that he's told you about your diagnosis of GERD, and he says you're still experiencing acute pain and you'd like to know a little bit more.
Is GERD an STD?
Actually, no. What happens with GERD, just to remind you, is that there's a backflow of some of the contents of your stomach that goes into your throat and irritates and kind of bothers the lining, sometimes even destroying and damaging some of the tissues.
That's gross. Destroying? Am I
Yes.
gonna be okay?
If we follow the right methods, we can help treat it and make it better. So I understand you're experiencing acute pain. Let me tell you about some of the things you can do to kind of help manage that. So in regards to when you do eat, you want to have smaller meals, and you can have them more throughout the day. That way it doesn't feel like you're having too much food and you're feeling too full. It's good to be drinking drinks between meals as opposed to during meals. That way you don't have too much fluids going on that could possibly come back up. After meals, you want to avoid laying down for at least 30 minutes or longer, depending on how you feel, because everybody's different. You should also try to avoid any trigger foods that you have, and if you're not quite sure what your trigger foods are, you can create a food journal so you understand, on this meal I ate this, and I felt this way afterwards. That way it's kind of like if you eat, say, spicy food and you realize that's a trigger food, you know you should try to avoid it or limit it.
On the other hand, a more insidious problem may be happening. Peptic ulcer disease may have similar symptomology to GERD, but it can develop to be a more serious problem.
Peptic ulcers is an erosion of the mucosal lining in the stomach, esophagus, or duodenum. Causes and risk factors include H. pylori, NSAIDs, corticosteroids, severe stress, familial tendency, hypersecretory stress, gastric secreting benign or malignant tumors of the pancreas, blood type O, excessive alcohol consumption, chronic pulmonary kidney disease, Zollinger-Ellison syndrome, and pernicious anemia.
Symptoms include burning stomach pain, the most common symptom. The pain may be worse between meals and at night. Feelings of fullness, bloating, or belching. Fatty food intolerance, heartburn, nausea. Nearly 3/4 of people with peptic ulcers don't have symptoms. Diagnostic studies include testing for H. pylori, biopsies, cultures, barium swallows and barium contrast studies, esophageal gastroduodenoscopies, lab tests including CBCs, liver enzymes, and serum amylase. But what can you do?
Treatment for PUD include drug therapy, antibiotics, proton pump inhibitors, histamine receptor blockers. Nutritional therapy. Avoid foods that cause gastric irritation, including carbonated drinks, caffeine, hot and spicy foods. Avoid alcohol. Surgical therapy. Ulcer removal or reduction. Therapy related to complications. NG suction, IV fluid replacement, and IV proton pump inhibitors.
Hi, I'm your nurse. How are you?
Okay.
Okay, let's talk about your diagnosis. You have peptic ulcer disease. It's basically an erosion of your stomach lining that causes ulcers.
Okay.
What's your main concern right now?
I have a lot of pain, abdominal pains, I guess, in my stomach area.
Okay, so pain's the biggest issue. So your doctor prescribed antibiotics. It's important for you to finish the whole course, even after you feel better. And it's important to cut out caffeine, smoking, or alcohol, and avoid taking NSAIDs, and manage your stress. Try meditation or yoga or any other relaxation techniques.
So I cannot take ibuprofen for pain?
You
Is that-
should not take that.
Okay. There are many community centers in Santa Clara County. Even if just one night a week, you can participate in a cooking class, such as in Campbell Community Center, or participate in open gym area at your nearest YMCA. However, ensure to follow up with your primary care physician for proper instruction and prescription to treat GERD and PUD.
There are many community resources for those who are seeking help, such as Santa Clara Valley Medical Center if you live in the city of San Jose or Santa Clara. If you have private insurance, you can always go to a clinic or a hospital. There are always online resources you can tap into, like these.
Who are you talking to?